welcome to ARBORVITAENXT. Today we are going to discuss about a condition known as Acanthosis nigricans. So what basically Acanthosis nigricans is, it is a dermatological or cutaneous manifestation of certain disease conditions. How it looks on the skin. So it is a symmetric hyperpigmented macule present on the skin which is velvety in texture. Now let's discuss about the areas which gets affected or where you can find this Acanthosis nigricans. First, you can see neck region. You can see it above the face region. It can be present mostly in axilla, in the flexor surfaces of elbows. You can see it around the umbilicus. You can see it in the groin area and medial part of the thigh. You can see it over the knees. It can also be seen around the anus. And in some extensive or excessive pigmentation is there, so it can be seen over the palms also sometimes. So when you see a case of Acanthosis nigricans, what should come to your mind? So this Acanthosis nigricans is a sign of impending diabetes usually. Even before the fasting blood glucose starts rising, you can see this Acanthosis nigricans present in the skin. But you should always keep in mind, occasionally it is a sign of various types of tumors. So it can also present as a paraneoplastic manifestation. So now let's come to the causes of Acanthosis nigricans. So basically, this condition is associated with insulin resistant state. So what are the states that are actually insulin resistant? One of them is obesity. Then condition number 2 is type 2 diabetes mellitus. Condition number 3 is polycystic ovarian syndrome, and other metabolic syndromes can lead to this insulin resistant state rising to the dermatological manifestation of Acanthosis nigricans. There are some causes which are less commonly there. Less commonly, it can be seen in hyperandrogenism and in case of autoimmune diseases associated with some drugs sometimes. If someone is on testosterone, nicotinic acid, oral contraceptive pills, corticosteroids, or any protease inhibitors, they might be having this Acanthosis nigricans. Now, apart from these causes, if the lesions are widely spread, or even the palms are involved, or it is seen in non-obese patients where the insulin resistance is less likely, then it may be due to breast carcinoma or lung carcinoma or stomach carcinoma. Usually, it is associated with adenocarcinoma of these organs. Now, let's come to the differential diagnosis. Differential diagnosis of Acanthosis nigricans includes confluent and reticulated papillomatosis, that is also known as Gogarot-Cartier syndrome. It can be epidermal nevus. It also can be Dowling-Dego's disease. In case of Gogarot-Cartier syndrome, a young individual might rarely present with this disorder. It usually presents as hyperkeratotic brown papules which may coalesce into brown plaques in future. So it might look like Acanthosis nigricans. Dowling-Dego's disease is a skin condition which is rarely seen, and in this condition this condition is characterized by a lacy or net like, that is reticulate pattern of abnormally dark skin, which is usually seen in the skin fold areas and creases. So now, what are the treatment modalities that you can think of? First of all, diet modification and lifestyle modification will help in reducing the insulin resistance. For obese persons, it is advised to try to have some weight loss. It has been seen oral metformin can be used and is beneficial for Acanthosis nigricans. Oral retinoids can also be used if the cosmetic part of the Acanthosis nigricans is only being concerned, laser treatment can also be tried to treat this condition. In case of malignant tumors, where this condition might present as a paraneoplastic syndrome, there the specific treatment for the tumor will help reducing this Acanthosis nigricans. Thank you for watching. Please subscribe to the channel, and such new contents are coming soon.